My feeling is that the way we're gonna, my hope is that the way we're gonna make the shift to addressing patients' social needs is because it's starting to become so obvious that social determinants affect both health and health outcomes, but also affect healthcare costs. And as a society, that cost issue motivates, right? So if we could save money by making sure that patients don't develop full diabetes or don't have a heart attack, and we can avoid if we can address social determinants as a way to prevent patients from incurring more costs in the healthcare system, that's a real motivator, I think. So I'm hopeful that the healthcare system and the healthcare providers will through this being motivated by addressing social determinants by its potential impact on costs. I'm hoping that they'll be willing that this is a way that we'll be able to get to addressing social determinants. Now your question is there a limit to where the healthcare system will intervene? And I think that, the limit is, I think that in a lot of cases, the healthcare providers aren't going to necessarily be the ones to provide the housing, right? To provide the food. They're going to want to just get the patients to the resources they can. Now, there are some that do. I mean, I'm aware of some healthcare providers that have, they do kind of a food bank at the clinic, or they provide some kind of childcare at the clinic. I mean, but that's few and far between, and it's hard to sustain financially those kind of services. So maybe that's a simpler answer to that question is, I think that healthcare providers, I don't think we should be asking them to provide the social services, and I don't think they want to. Well, I don't think they can. I don't think that's feasible. But helping them make those referrals, connect to the community resources, the community agencies, that's I think within their purview. The other way you might want to think about this is in terms of what is the healthcare setting. Again, I mentioned primary care, family medicine, pediatrics. Those kind of providers, this is going to make much more sense for. I think when you're talking about, maybe some inpatient care, it may just be a whole different set of issues that frankly, I haven't thought about. I know that there are folks who do, care management, social work out after a hospital discharge to make sure the patients who are going home after surgery or something have appropriate care or some kind of support system. That makes a lot of sense. But it might be that it might depend on what kind of care you're getting and what kind of system it is, right? So again, if you're checking out of a hospital, there might be certain social factors that team, the healthcare system, would take on versus what your primary care provider and their team is willing to take on.